Hi, my name is Sara Gerke. I'm an assistant professor of law at Penn State Dickinson Law. I teach torts, healthcare law and policy, and food and drug law. My research focuses on the ethical and legal challenges of artificial intelligence and big data in healthcare and health law in the United States and Europe. Before I joined Penn State Dickinson Law, I was actually a research fellow in medicine, artificial intelligence, and law here at the Petrie-Flom Center for Health Law Policy, Biotechnology, and Bioethics at Harvard Law School. And before that, I was a general manager of the Institute for German, European, and International Medical Law, Public Health Law, and Bioethics of the Universities of Heidelberg and Mannheim. So I would like to tell you a little bit about my project as part of the 2020 Petrie-Flom Center annual conference. So it's focusing on the labeling of direct-to-consumer medical artificial intelligence applications for self-diagnosis. I also call these apps DTC medical self-diagnosing AI apps. And I define this term very broadly as apps that help individuals identify a disease or other condition based on entering, for example, symptoms. And so the digital health apps market is currently booming with over 350,000 health apps available to patients and consumers. In 2020 alone, 90,000 health apps have been made available on app stores, such as fitness apps or disease management apps. And that's an average of nearly 250 apps daily, some of which operate using artificial intelligence AI. So a very important subset of AI is machine learning. And that has become one of the most promising fields of computer science in recent years and uses algorithms to detect patterns in data. So in particular, in my project, I look at DTC medical self-diagnosing AI apps, and they are really emerging. So before, instead of going to the doctor's office, consumers are trying more than ever before to self-diagnose their conditions by, for example, putting keywords of their symptoms into search engines like Google, or using DTC medical self-diagnosing AI apps. So for example, nowadays, you can get heart health notification on the Apple Watch. So for example, Apple does not offer only an electrocardiogram app, but also an irregular rhythm notification feature app that notifies users if there is an irregular heart rhythm suggestive of atrial fibrillation. And another example is Ada. Ada is an AI-assisted symptom checker. So consumers are just answering a couple of questions about their symptoms, and then Ada will suggest possible causes of the symptoms and also offer advice. And so in my project, I focus on such apps and similar apps and explore the current and future landscape of DTC medical self-diagnosing AI apps. And I also analyze whether such apps are actually classified as medical devices under the Federal Food, Drug, and Cosmetic Act and are subject to FDA regulation. And in particular, I focus on two labeling challenges associated with DTC medical self-diagnosing AI apps. So the first is the concern of labeling of DTC medical self-diagnosing AI apps as information tools only. And the second one is particular issues associated with the use of AI, ranging from bias to adaptive algorithm. So let's look a little bit at the term labeling. So the term labeling is defined in the Federal Food, Drug, and Cosmetic Act, and it's a very broad term. It's defined as all labels and other written, printed, or graphic matter upon any article or any of its containers or wrappers or accompanying such articles. So what this means is that the term labeling is very broad. It's an umbrella term that includes all kinds of labels. And in the context of DTC medical self-diagnosing AI apps, the label will usually be available in a non-physical form through the app itself. So what is one thing I'd like you to know about this area? So I would like you to know that DTC medical self-diagnosing AI apps, such as Apple's ECG app or Ada, usually claim to be not intended to provide a diagnosis. So what that means is DTC medical self-diagnosing AI apps are labeled as information tools only rather than diagnosis tools. So there appears to be this discrepancy between the user's interpretation of the intended use of DTC medical self-diagnosing AI apps and they are actually intended uses, so not to diagnose. And indeed, a recent study by Meyer et al. Showed on AI-assisted symptom checkers that 84.1% of a total of 301 respondents perceive them as diagnostic tools. And so this misperception, I believe, can also be, among other things, due to the fact that users are not reading labels. And labeling has many benefits, such as helping patients and consumers to be more informed and making better decisions by informing them, for example, about the potential limitations of these apps. But of course, if patients do not read the labels and accompanying statements, and then a language like the device is not intended to provide a diagnosis is somewhere buried within them, then using DTC medical self-diagnosing AI apps may become risky and also jeopardize patient health. So for example, imagine a patient uses an app to detect and screen herself to screen herself for skin cancer. What is if the AI misses a melanoma and the patient just doesn't go to the doctor's office because she thinks everything is all right? Another question is, what is your prediction for how this area will progress, or what would you like to see happen in this area? So I believe that in the next coming years, we will see more and more DTC medical self-diagnosing AI apps available and entering the market. And so I would really like to see that stakeholders, such as regulators and app developers, do a better job of educating consumers about these risks. And I believe with the right design, labels could actually help to achieve this goal. So several groups have already shown the benefits of eye-popping label designs, such as with the help of nutrition labels or model facts labels. And so I believe it will be very important that regulators like the FDA could, together with the help of stakeholders, develop user-friendly label design options for DTC medical self-diagnosing AI apps. And in this context, I think would be very important that the FDA should also focus on the contents of these labels, and in particularly focusing on the peculiarities of AI in this context.